On. Boom! 3, 2, 1, go! We're live talking about some MRIs here coming up in
What's going on?
3 minutes here. That's Dr. T. Welcome to our
Cave.
Sweet cave back here. We've got some lighting set up this time that I don't think is going to explode on us.
We've been working nonstop, so we're doing our Facebook Live back here. Next time you're going to see a studio.
It's going to be crazy. We're going to have the goal is to have some pull-up bars. We're going to have a table. So Dr. T can show you all these fun techniques she uses.
Yes.
To make people all healthy. What are we talking about today? We're not starting yet. We're just telling you what we're going to talk about. Molly, are you on there right now? Can you say hello to the people? Or hello to us so we know you're hanging out? Whoever these 3, 4 people are, please tell us who you are. Tell us where you're from. We like to know these things so that we can make it a little bit more personal.
We are talking about MRI. You're not your diagnosis.
Yeah. MRI is super fun. Everyone's got one. No one knows what the hell it means. Including, most of the time, the doctors that are handing them back to you, right?
Well, so an MRI is magnetic resonance imaging. And
Mr. Wilson, the original
what's up,
believer.
Bob?
How you doing, bud?
No, it's pretty common with we're going to get into this, the increase in MRI machines and imaging technology.
Ooh.
That there is...
Got it. We had a balancing problem. We're back. Nope. Close. I just need to get a wider base. There we go.
Yeah.
Science.
Wider base of support.
Right?
That always helps with stability. Nugget. No, so
wide base.
The nice thing about MRIs is that they are accurate, fairly accurate. I mean, if you have if you have one person assessing the imaging itself, it's very accurate. The more people that are assessing your imaging, the accuracy goes down as to the information you're going to get. But they can be effective. I'm just going to tell you how and when they can be effective and why they're not very helpful most of the time. They're only really needed for specific cases. But doctors use it because a lot of doctors have gotten away from physical, actually doing hands-on care and assessing the patient, and they're having to see more patients to get paid, right? They want to get reimbursed. And so an MRI is the easy thing for them to have you to do. Yeah, they're expensive, especially if you pay out of pocket. But it's easier for them to look at the MRI and then for them to get the diagnosis through that versus them doing hands-on, because that takes more time, unfortunately. Right
on, team. 12:01. Dr. T's already told you too much. If you can, chime in, tell us who you are, tell us where you're from. We've got Philip Wilson on here, Molly's on here. I know Philip is up in LA County Fire in the house.
Hello, world.
Philip, we need to talk about LA County Fire one of these days because we have some big fun things that we're working on with some other departments, and we see you. We're going to come hang out with you. We are talking about MRIs today. 3 things your MRI is not telling you. So we're going to start off, Dr. T. I am going to ask her a few questions because I'm dying to know a lot of these things. I always come from these things from a strength coach side of things and a movement side, and I am your typical male human being that has no interest in listening to doctors outside of that one. And I feel like through movement, I can fix everything on my own. So the MRI thing is always very interesting to me, being in this world now that I see them, I get to read them. Kentucky, Matt, how you doing?
Hey, Matt.
Hey,
Molly.
So it's interesting because I've always believed that we can kind of fix our own problems through the education piece and learning exactly what's going on in our body. That's one of the reasons we started doing this thing, kind of combining the medical world and the strength and conditioning world. And Molly, if you can put it up, there is a little score thing that we're working on, the low back fix score. And what we've done is kind of taken some of these big questions that, Nancy Cote. She was like my best friend's mom. Well, she still is his mom, but we hung out when I was like 6. How you doing, Nancy? Good to see you. So when we see all these diagnoses and we get all these people, so click on this fun link here, and you're going to take just a 10-question little quiz to kind of find out where this pain is at, what's causing it, what you're struggling with the MRI stuff, and then you're going to get like a very specific set of instructions and ways that you can help that pain and your specific situation based off the score that you get. Dr. T and I have put together this little package so that you can take the score, find out specifically what's going on, how much this is affecting your life, and then we can start to put some pieces in place that are going to help. So getting into this MRI piece, can you kind of break down, we talked a little bit about the pre-show, but what is an MRI? What leads people to get them, and what are some of let's end there. So what is an MRI, and what are kind of the steps that get people into the MRI tube?
Okay, well, those are good questions, Anders. You guys are like lean into the camera here, so you can really listen in on this, because this is important stuff. So an MRI means magnetic resonance imaging. It is basically this large, who here has ever had one? Raise your hand. I have. I just had one actually, probably, I don't know, 4 months ago, because I had to get MRI of my baby when I was pregnant. That was a whole different story. But, so MRI is magnetic resonance imaging, and it's this large, it looks like a spaceship that you have to go in, and it's very tight. It's a very tight structure that you sit in, not sit in, but you lay in, and it takes a while. So MRIs can take anywhere from 45 minutes to 3 hours. The imaging, the MRI I just did for my child was, when I was pregnant, took about 2.5 hours. Typically, for a musculoskeletal issue, such as low back issue, knee, it may take 45 minutes to an hour. It takes a while, but it's loud. And those that don't like confined spaces, then it's going to be very hard. But the interesting about an MRI is that it's magnetic, right? So you can, you're not going to need radiation poisoning or anything like that. And it is for those of you that have pacemakers or any kind of metal in your body, not the imaging device that you want to have. So, I mean, technology is pretty amazing. An MRI can do a lot of things. Specifically, it is for diagnosing soft tissue issues, anything to do with organs, soft tissue, disc issues, ligaments, meniscuses, and it can also diagnose bone issues too. So an X-ray is cheaper. It typically is good for bony alignment, any kind of joint space issue or bony issue. A MRI goes much deeper. It looks at the soft tissue. It looks at the cross section of the soft tissue. So what a doctor will do, a radiologist, they'll look at the cross section, the MRI cross sections of the areas they want to look at, and then they'll print it out on a piece of paper, and you'll get your impressions and the results. And that's usually what you guys get. And then that's what you guys give me as the PT and Anders as the coach. So oftentimes, from the radiologist to the doctor, there might be miscommunication, things of that sort, or like usually radiologist obviously has to read the MRI report, but the way the doctor portrays the MRI report might be different depending on what doctor you see, whether it's an orthopedist or primary care. So I kind of want to go into that next as to why you would get an MRI and then the results of what's going to happen after. So, and I'm speaking mostly to musculoskeletal injuries. So like the stuff that we see, low back injuries, disc injuries, stenosis, any kind of low back injury that you haven't had diagnosed. Let's say you go to your doctor first and your doctor says, well, I think it's this, without even doing a physical examination usually, because they don't have a lot of time. You go see your primary care, they'll send you to get an MRI to see what it truly is. But the MRI will come up, so the MRI will tell you it's 90% accurate. So like I was saying in the beginning before we even started at 12, MRIs are 90% accurate. That's pretty high. So it's good. So it's going to tell you what tissues are, not where the problem is, but where the tissue that's injured is. But it's definitely not going to tell you where the cause of that injury is. So stenosis, disc issue, it'll show you which disc is the problem, which joint space is the problem, which soft tissue is the problem, but it's not going to tell you the cause of it, right? But we tend to get so caught up in those results. So you get the MRI, the doctor says, if it's an orthopedist, an orthopedic doctor gets the results, you're more likely to go in for surgery and surgery might be the outcome. So you're 34% more likely to have surgery had you had your results read from an orthopedic doctor than a primary care physician. Primary care physician will typically send you to a conservative route, such as a physical therapy, chiro, whatever, which is very interesting. So depending on who's reading your MRI results, think about it. An orthopedic surgeon, right, is probably going to refer you over time to surgery, and research shows 34% more likely, which is kind of crazy. That's a big percentage. And then a primary care physician, less likely to send you in for surgery right away, more likely to send you to conservative care.
And I think the other thing that is really interesting about the MRI is it's very rarely people's first step.
Right, exactly, and that's a really good point. So it shouldn't be your first step. Yeah, so I think that people they have an injury, they go to a doctor. What does a doctor do because of reimbursement rates and time? They send you to get imaging. Typically it's an x-ray first, then it's an MRI. The thing though is that conservative care is definitely the route that you're gonna wanna go first.
Yeah, I also have found with the MRI thing, there's always, and it's one of the biggest things for the pattern interrupt that we are trying to create is in pain, go to the chiro. Chiro doesn't work, go to the PT. PT's working, but you want more immediate, there needs to be some diagnosis, and then they go to the doctor. Doctor goes to the MRI, and now all of a sudden you're 5, 6, 7 steps into this process of understanding just what's going on, when the truth is we can sit down and go through a very simple set of assessments based on your movement patterns and your ability to kind of breathe properly, understanding the tissues in your body, and then we can start to put a little bit better plan together versus what's being manipulated, what's being massaged, what's being, hit with pain pills, and then none of that's working, so now we have an MRI, and then what ends up happening is you start going back through that same cycle over and over again because you've got this chiro that didn't work, you've got a PT plan that didn't work, you've got X and X, all of these things didn't work, and now you have this diagnosis or you have this MRI imaging with you, and you go right back to the original source and you say, here's different information. The truth is all of these things can be, well, I shouldn't say all of them can be, but the conversation needs to change from how do I fix this to understanding what the problem is. And for so many people that we see, and when you get into taking the score that Molly's posted up in here, you can follow that link. But when you get into understanding a lot of once you've gotten to the point of the MRI, there's no new information that you're bringing to people. They're going to go back to day one of crack the neck, crack here, crack there, and then you go to the PT, or you go all of these pieces. And what is so important, I think, about what we are working on right now is the combination of these things. So you're not going to be able to go to the PT. So we all have postural issues. I'm sitting in a chair right now, she's sitting in the chair, and I can promise you we're not in perfect posture while we're sitting. Like, it's just not possible, right? But what we're able to do is we can kind of look at, some posture. Can you bend over and touch your toes? Just very simple assessments. And without even you going to do this MRI piece and then going back through this cycle, you can start to learn the pieces of this that are going to say like, oh, now I kind of understand why my back hurts, versus here's my diagnosis, here's the MRI that proves I'm right, and now I need to go find a doctor that can help this specific thing. And when you go and you're in the program and you're understanding what, from the doctor PT side of things, there's a protocol that they're going to go through and going through these assessments, but it's all in in a place where you need to continue the practice. So we can't just go get healthy. We have to practice being healthy. And that's where the personal training and the programming side comes in of, okay, Dr. Theresa is going to make you healthy on day one. You're going to feel better. Her mobility and stability plans are genius, right? But if you do that one time and stop, we've made no changes. You have to be on a plan. So we're going to be able to do all of these mobility and stability pieces on a daily basis, right? We have to be able to learn how to downregulate and get into the tissues. The next piece, we have to start working on retraining the movement patterns, right? So all those pieces, you may have your MRI imaging with you, you may have your diagnosis, but what is kind of when someone comes in and it's almost like people are proud of having this piece of paper, and now they can like attach their feelings to a thing and they just hold it. It's like, my doctor gave me this, and it's like, back up a second. Let's talk about some of the systemic things that are going on.
There's an identity to it, unfortunately. So, I mean, because not everyone has a medical degree, right? You're good at your trade, but when you have those MRI results, people tend to identify with it. I have a bulge disc. My bulge disc is flared up. My neck, my sciatica is flared up. My stenosis is flared up. Well, you are not those things. Like, here's another bit of research. If I were to take an MRI of 100 people, random people out there, over the age of 30, 60% of those, and not worrying about symptoms at all, no symptoms, not even worrying about if they have low back pain, 60% of those individuals will have a disc bulge issue, a disc dysfunction, we call it. Whether it's herniation, disc bulge. So 60% will have some kind of disc dysfunction, and they might be even asymptomatic, right? So not even worrying about back pain, 60% of those individuals, you're gonna find an MRI, you're gonna find something wrong in an MRI, always. But does that mean someone has to be symptomatic? No. But it seems that our culture is revolving around this fear of, I have pain, I gotta go get an image, I have to go to the doctor. Well, all those are good thoughts. We wanna give you a more effective plan to help you ease your mind and not scare you.
Yeah.
Right? Because there's so much, your body is incredibly, incredibly resilient. And getting an MRI right away or going to see a doctor is only going to perpetuate you spending more money, scaring you more, and most likely leading to surgery over time.
Yeah.
And whereas this conservative approach, we're designed to move. We're not designed to sit, we're not designed to be in one place all the time. But it is a longer approach. It means you have to have patience. It means you have to cultivate these, like slowing down, not overtraining.
Yeah.
I had a guy come into my office, very, very well-known individual in the fitness world who has stenosis. And it's the diagnosis I gave you guys, talked about last week. And the hardest thing for him is to slow down. He doesn't want to change movement patterns. He just wants a quick fix. He wants the MRI to tell him he's got this issue, and then what? Then what are you gonna do?
Yeah.
You're gonna go to get surgery because that's gonna be a whole nother can of worms, right? That's needed in only probably 4 to 5% of all musculoskeletal issues, guys. 4 to 5%, that's it. So, this guy actually is well known in the fitness world, but yet cannot wrap his mind around changing his movement pattern. The fact that it took for freaking ever to get to where he is now, he doesn't want to put in that time. And the thing is, guys, and ladies, you have to be willing to take the slow route. Be willing to have patience. Be willing to take this vulnerable pain and learn from it. But you're not going to learn from it from just getting an MRI that's going to scare you into doing something that you're not going to be able to ever turn back time on.
Yeah, I think a lot of this stuff really turns into understanding that this isn't a quick fix. You didn't quickly hurt yourself unless there was some sort of trauma experience. You accumulated these problems over a very long time of poor lifting, poor moving, whatever it is. And the answer to these is relearning these movement patterns and relearning the proper way to do things which you haven't been doing. So when people go get their MRI, it's always now I have it. It's like if you can hold on to this thing in your hand. And There's a couple other points that start to get to me, and I'm not a doctor. She kind of handles all of the more diagnosis side of things, but what I notice a lot when it comes to people that are handing out, it's almost like they're handing out candy, like, here's your diagnosis. When they hand these things out, you can go see multiple specialists that will read your MRI, and there's a very good chance that you're going to get multiple diagnoses and be even more confused than when you showed up. And the truth is like, people don't actually know the answer, but you're standing there in front of them, you've paid them the money, and you're paying them for an answer. And the problem is, they might not know. They may really have no clue what some specific tiny thing that you're looking for is, so they hand you this and they say, sciatica, stenosis, spondy, whatever it is, and the truth is like, the movement pattern is the answer to kind of finding these things out. And you're going to heal by moving better, learning proper ranges of motion, learning how to downregulate your muscle tissue, and all of these pieces have to flow together, or what's the number one cause of future injury?
Already having one, as well as overtraining.
Overtraining and past injury. So if you're sitting there and you have back pain right now, good luck. It's going to be for a really long time, right? Because it seems to repeat itself, and it repeats itself because we never take the time to say, I'm dealing with this, and now I have this piece of paper that says, like, this is my gold star for the day, like, I'm right, I knew something was wrong, this piece of paper proves I was right. We can say, hey, I'm not perfect, I need to get back to the baseline of understanding movement patterns so that I can start to progress this thing forward and learn how to live pain-free versus just going and trying to put a Band-Aid on a much larger problem. That's something that I see a lot. There is no actual answer to it because we're dealing with an entire system throughout our body that is dysfunctional versus being able to find one specific stretch, one specific movement, one specific thing that all of a sudden is going to just answer all the questions, and it doesn't work like that. We have to view our body on this macro level and understand how all the pieces flow together, and that's what's great about the program is when you get in and you click on the link that Molly did in there, and you'll kind of start to get an understanding of how the program is put together based on like your score, and what the results are of that. But where you can start to learn this thing is it isn't just putting a Band-Aid on the problem, it's creating a way of thinking about your body and thinking about the way you move through this world so that you can understand how to sit down properly. The number of people today we had somebody sneezing. Sneezing is freaking monster. There's a whole lot of abs going on in there when you start sneezing. And that stuff, people need to learn how to do that. And the best way that we can do that is teach you how to brace your core properly. How do we do that? Well, we have to learn how to breathe properly. So all these pieces are not just stuck in this one tiny little diagnosis or MRI and picture and your gold star for the day says, I was right. This paper proves it. No, we have to start viewing
What are you going to do about it?
Yeah, exactly. Like, what are you going to do? We have to start breaking this down to the baseline and getting back to understanding, like, how do we breathe properly to stabilize our low spine, and start layering the pieces onto this so that it starts to become this full understanding of human movement and taking care of our bodies instead of just gas pedal, go, now I'm hurt, put a bandage on it so I can just go more.
Yeah, and honestly, it still is a very novel way of thinking in the Western medicine world. Is like, okay, whatever diagnosis you've been given or think you have, what's the universal thing that, works for all of us is movement. Like, so something in the movement pattern, in the way you sit, the way you stand, the way you squat, has caused this dysfunction. It doesn't just happen from laying down and doing nothing. It didn't just happen overnight. It didn't just happen overnight too. It could have just happened actually from sitting for 8 hours a day nonstop. Yeah. But it doesn't just happen overnight. So the key is you have to You have to give your body a chance to heal and be resilient, and because it totally can be. And the thing about the program is that it's going to teach you. So if Anders had the diagnosis of stenosis and has back pain, I have back pain. I don't know what the heck is going on. I don't have any of the weird signs and symptoms like peeing blood or pain, intense pain at night, excessive weight loss, weight gain in the last 6 months, things like that are red flags that are like, okay, I need to see a medical doctor. You're not vomiting or have excessive fatigue. If you have none of those things, okay, and Anders has the diagnosis, maybe a disc dysfunction, and I have back pain. We both have back pain, but he knows what he has based on the MRI and I don't. We both do this program because it's both testing our movement patterns, our global movement patterns that our bodies, our spines are supposed to be able to do. And we find out we actually have the same issues. We can't bend over and touch our toes. We can't rotate to the right. We have trouble with balance, eyes closed on our left. Well, we're both going to be going down a path of fixing those things. Yeah. And by the end of 8 weeks, we both are pain-free. He knows what his diagnosis is. I don't know what mine is. I feel freaking amazing. He's probably wondering, did my stenosis go away? Did my stenosis go away? Did my disc dysfunction go away? Right? It adds more of a crap. Like, now I have to go back, pay my doctor to get another MRI to see if it's gone away. Yep. That's more money out of your pocket when you're feeling amazing. So continue down the path of, maybe you can touch your toes now. Maybe you can rotate better to the right. Those are the things you want to look at. Now, an MRI, I just want to make sure that you guys know that MRIs are needed for some things, right? Cardiologists, it's really helped decrease by a little bit heart issues, cardiac dysfunctions.
I think it's about understanding. You take your car to a car mechanic. If you have a movement problem, you should go see people that specialize in teaching quality movement. There's people that are good at MRIs and seeing problems with those images, and then naming them so you can attach yourself to them or seek options for that. But when we start to talk about movement is medicine, and that's why we got into this, because we realized that the benefits of understanding quality movement really are at the heart of this understanding health piece. And when you start to understand the care that goes into it as well, the kind of the emotional draw that I feel from people is it's very disheartening, because you get that piece of paper and you get that diagnosis or the MRI or whatever it is, and then the people basically send you out the door and they'll tell you to rest, and that isn't necessarily the answer, right? Like, we need to learn how to rest properly. There's an entire host of things, and what we have taken a ton of pride in is actually working with people on a day-to-day basis. We have Facebook groups set up for people to get in, post videos of their movements, understanding this education side of, like, how do we load our glutes, how do we use our hips properly, and learning movement patterns that are going to help you, as well as just having someone that actually cares and is along with you on the ride to getting healthy. That's the real health care side that's missing, is how much care are these people actually putting into the process of making you feel better, and understanding the vulnerabilities and the insecurities that go along with you holding onto this piece of paper that says this thing. And without us really knowing, that is something that we've gotten very good at, is understanding that you're in this scary space and that you need someone to just freak out a little bit on, that's going to listen, and the vulnerability shows. And what that vulnerability does a lot of times, if you don't have somebody there, is it creates more stress, puts more tension in the muscles, not sleeping well, and now all of a sudden we're back into this cycle, and you're looking for answers without ever understanding what the core problems are.
That's what we wanted to tell you guys today, is that there is hope. Right? You put it beautifully, like putting the care back in healthcare. I think that's what we are working to do. Yeah. Developing knowledgeable humans out there about their movement. So you can take this information and keep yourselves healthy forever.
Yeah. Get into the link. If you guys have any questions, if you guys are watching this on the rerun, make sure you get your questions up and we'll be sure to get them answered. Molly, if we can post the link so people can schedule a call with us, that way it's up there. You can speak to Dr. T and I, discuss whatever diagnosis or MRI that's come through for you, and we look forward to it. We're going to be posting an article tomorrow breaking some of the higher level points down at thelowbackfix.com, so make sure you get on there, check the article out, get into the score so you can get your individual plan based off the results of that questionnaire. Schedule a call with us. So many calls to action. The truth is we just want to work with you and make you better and really open the world up to understanding that there's way better ways to do these things that don't involve fear and kicking you out the door and treating you like crap.
And a lot more money out of your pocket.
Yeah, save time, energy, money. Thank you guys for tuning in. Make sure you get your questions up, and we will
see you next week.
Talk soon, guys.
Later.